Have you ever actually stopped to wonder why the world's highest performing dairy cows, animals bred for absolute peak biological efficiency, are suddenly struggling to do the most natural thing in the entire world? Have calves? It's a massive paradox, really. Over the last few decades, we've seen a staggering drop in conception rates across the dairy industry. We're talking about tumbling from a healthy 65% down to just 40%, and in some modern herds, it's even lower. Okay, let's dive into this. Today we're unpacking the paradox of bovine infertility, breeding for milk, losing the calf. We're going to explore the science, the economics, and the honestly bizarre biology behind why the modern dairy cow is facing a reproductive crisis. And we'll be using data and research straight from veterinary science to do it. Here is our roadmap for this explainer. We'll be looking at 1. The bovine fertility crisis, 2. The staggering economic cost, 3. Anatomy of the problem, 4. The free martin phenomenon, and finally, 5. Acquired reproductive roadblocks. Let's jump right into Section 1, the bovine fertility crisis, a 50-year downward trend. Historically, first-service conception rates sat comfortably around 65% back in 1951. But fast forward to 1996, and that drops to 40%. And recent pregnancy rate data? Well, that's often plummeting all the way down to 27%. So why is this happening? The short answer is metabolic stress. We've selected these animals for such incredibly high milk yields that their bodies are literally prioritizing lactation over reproduction. The metabolic demand is just so intense that the reproductive system basically says, nope, we can't do both, and shuts down.
So what happens when a cow simply cannot get pregnant? Well, she has to be culled or removed from the herd. Now, to put this into perspective, in the 1950s and 60s, farmers only had to cull about 5% of their herd for this issue. Today, that figure is hovering around 20% in the UK. And astonishingly, research shows up to 40% of Polish Holstein Friesians are culled for infertility and reproduction problems. Farmers are being forced to remove cows from the herd at a pace we've literally never seen before.
Moving right along to Section 2, the staggering economic cost, translating days into dollars.
Now, you might think this is a totally new problem. Actually, scratch that. Experts have seen this paradox coming for decades. Just take this statement from Bosworth and his colleagues all the way back in 1972. They flat out stated that infertility is an important economic loss and that modern management practices actually accentuate the problem. They knew over 50 years ago that our intensive management practices and our relentless pursuit of yield were actively fighting the cow's natural biology.
The financial reality on the ground today is, frankly, staggering. Based on research by Cabrera examining total mixed ration systems, a farmer gains $14 in economic net return per cow per year for just a single 1 percentage point increase in their 21-day pregnancy rate. When you multiply that $14 by a herd of hundreds or even thousands of cows, you see exactly why farmers care so deeply about every single day a cow remains open, which is just the industry term for not pregnant. Every single day without a pregnancy is money out the window.
Let's shift gears from farm spreadsheets to the veterinary operating table in Section 3, Anatomy of the Problem, zooming in on the biology.
Basically, the overarching causes of bovine infertility fall into 4 main buckets: structural anomalies, ovarian dysfunction, stockmanship or management issues like missing the signs of estrus, and infections. For the rest of this explainer, we're going to bypass the farm management side entirely and zoom in specifically on the physical, structural roadblocks inside the reproductive tract. These are the physical glitches that stop conception right in its tracks. Let's introduce our first structural glitch, a total freak anomaly called uterus didelphys. This is a rare congenital condition where the paramesonephric ducts, those are the embryonic structures that form the female reproductive tract, fail to fuse completely during development. The result? The cow is born with a double cervix. The internal plumbing is literally duplicated. Now, what's really interesting about this slide is the sheer physical reality of 2 completely separate cervical canals sitting right side by side. Imagine the complications here. While these animals can sometimes conceive if they're artificially inseminated into the specific horn that matches the side of ovulation, they frequently face dystocia, that's severe difficulty giving birth. Why? Because fetal limbs might try to enter both cervical canals at the exact same time. It's a logistical nightmare. Our next structural glitch is segmental aplasia.
This is historically known as white heifer disease due to this really fascinating genetic connection to the white coat color of shorthorn cattle. In this condition, isolated sections of the uterine horn simply fail to develop at all, effectively creating a dead end and blocking the reproductive tract.
This can result in something called a uterus unicornis, where one horn is just this flat, useless band of tissue. Alternatively, an isolated portion of the horn might trap natural glandular secretions, distending into a massive, balloon-like fluid-filled sac. You could have a perfectly normal, functioning ovary ovulating beautifully, but the egg is completely trapped behind this biological roadblock. Conception on that side is just absolutely impossible.
All right, moving on to Section 4, the Free-Martin phenomenon, a biological anomaly. This might just be the most fascinating, kind of mind-blowing biological glitch in this entire explainer. Free-Martinism is a distinct form of intersexuality that occurs in a female calf, born as a twin to a male. And this isn't just a random mutation. It's a completely predictable biological chain reaction caused by the vascular fusion of their placentas while they're still developing in the womb. Staggeringly, about 95% of female calves born with a male twin suffer from this exact condition. No way around it.
Here's how this bizarre chain reaction actually unfolds. First, we have the twin conception, one male, one female. By roughly day 30 of gestation, the blood vessels of their two placentas fuse together. This is called the vascular anastomosis. Because the male twin develops his testes earlier, his masculizing hormones flow directly into the female twin's bloodstream. By the time they're born, the female has been profoundly masculinized, and she actually carries her brother's cells in her blood. That's a wild chromosomal state called chimerism.
The physical evidence of this is pretty striking. Internally, the reproductive tract is completely underdeveloped or just missing entirely, and the gonads are basically vestigial. Externally, the masculinization results in coarse hairs and an enlarged, prominent clitoris. These heifers are completely 100% sterile. In fact, diagnosing this early on is a huge economic priority on the farm, so farmers don't waste years of feed and resources raising a heifer that can literally never breed.
Finally, let's wrap up with Section 5, acquired reproductive roadblocks, wear and tear. While birth defects like Free-Martinism are wild, the vast majority of structural problems actually happen over time due to simple wear and tear. Let's briefly contrast these two categories so we're totally clear. Congenital lesions, like the segmental aplasia we talked about, are rare and present at birth. The animal is born with them. Acquired lesions, however, are very common and develop over the cow's lifetime. These are your infections, your traumas from the stress of giving birth, and your tumors. We're moving from the rare right into the everyday reality of farming.
A prime example of this is overall bursal adhesions, where fibrous tissue completely envelops the ovary like a tightly woven net. This usually happens after a local infection or trauma, very often from the puerperal period right after calving. The inflammation causes these fibrous web-like strands to grow and wrap around the ovary. It literally physically traps the egg, preventing ovulation and rendering the cow infertile on that side. It's a major reason why some individual cows regularly return to estrus without ever actually getting pregnant.
And what's really wild is what happens with massive granulosa cell tumors on the ovary. While most ovarian tumors in cows are benign, they can grow to truly astonishing sizes. But the real damage here is hormonal. Granulosa cell tumors can secrete estrogen, progesterone, or androgens, which completely derails the cow's natural estrus cycle. They can throw her into constant, persistent estrus, or just shut her cycles down completely. It acts as a massive biological roadblock.
So what does this all mean? We've seen the 50-year drop in fertility, the staggering economic fallout, the bizarre congenital glitches, and the physical toll of acquired lesions. It really forces us to ask a difficult but absolutely crucial question. Have we pushed the cow's biological limits past the breaking point just for the sake of milk yield? At what point does our modern demand for agricultural efficiency break the very foundation of the animal? Thanks so much for joining me on this explainer, and keep questioning what you learn.